As COVID numbers surge in Arizona, health leaders sounding the alarm, saying they may not have the staff to handle a huge surge in patients.
And ABC 15's Mike Pelton joins us outside Valleywise Health Medical Center. Mike, lots of talk about hospital capacity, but the headline today, the staff shortages could become a problem in the coming weeks.
Well, the chief medical officer for Valleywise Health tells us they have staff to cover 30 ICU beds today. They're 90% full, so as of this morning, they had just 3 available. But consider this, he tells us they have 6 additional unstaffed ICU beds, showing just how important people are in treating patients.
We are at a tipping point, here within the state of Arizona.
Valleywise Health Chief Clinical Officer Dr. Michael White says if conditions worsen, modifying elective surgeries is on the table, a step every health system wants to avoid amid an uptick in COVID-19 patients. Valleywise now with more than 40 of them and counting.
We would have physical beds available. We just need to have the right qualified healthcare team members available, nursing, bedside staff, to be able to care for those patients at the appropriate level of care.
Across town, Banner Health also expressing concerns about staff to handle a surge. Chief Clinical Officer Dr. Marjorie Bessel says they are looking to fill 900 more positions.
Our space, our beds, our PPE, our supplies, our equipment are not likely going to be a rate limiting issue for us. It will be our staff.
And consider what they're up against. Dr. Bessel says they've prepared to exceed licensed bed capacity. Here's a copy of their bed capacity forecast, which shows they could hit 125% capacity around December 4th.
Mitigation right now is what helps us prevent getting to that 125%. We know from experience, both within the state of Arizona, in the United States, as well as other countries across the world, that when you take a strong mitigation step, you will start feeling relief in about 2 weeks.
And Dr. Bessel hopes you think about the choices you make this Thanksgiving and keep your circle small. Now, she tells us in a worst case staffing scenario, Banner could allow nurses to work who were COVID positive but asymptomatic. Now, Valleywise tells us they're not considering that as an option, but all of our hospitals are bracing for a tough couple months ahead. In Phoenix tonight, Mike Pelton, ABC 15, Arizona.